I'm very happy to introduce Ms. Naomi Cytron. First of all, I want to say that as a city health department, we are very interested in data. We use it a lot in different ways and are trying to figure out how to use it better to promote community health. We've done some things like zip code analyses for infant mortality rates and working with partners to try to decrease the infant mortality rates in Cincinnati. We've produced neighborhood-level mortality statistics and life expectancy statistics. But the question is, once you produce it, then how do you actually get traction? How do people really use it and run with that information to improve health? Things that we're doing include health impact assessments, increasing access to care, but how do you use all that data that we're generating in a way that's useful for communities? So we know that access to data for performance management is very important, and that's why I'm excited. I'm excited about having Ms. Cytron here. I'm excited that she gave us all the book, and I'd like to just introduce her very quickly. Ms. Cytron is a senior research associate in the Community Development Department at the Federal Reserve Bank of San Francisco. Prior to joining the Federal Reserve Bank, she worked as a consultant on affordable housing finance, and she managed a fair housing testing program. She has a master's degree in city and planning from the University of North Carolina at Chapel Hill, and much of her research has focused on neighborhood change, neighborhood revitalization, and regional equity. She's authored numerous reports and articles on topics including concentrated poverty and transit-oriented development, all of which are very, very relevant. And she was the senior editor for the book that she provided, What Counts? Harnessing Data for America's Communities. So I'm really looking forward to hearing her insights about how to use data to improve health and equity in communities, and encourage everybody to think of really great questions. I have some if you don't, but I'm encouraging everybody to really use her knowledge. Thank you.
Great. Thank you so much, Camille. And thanks especially to Interact for Health and the Foundation for a Healthy Kentucky for inviting me to speak at this event and for really framing the agenda around What Counts. What Counts was a labor of love for me last year, along with folks at the Urban Institute. We published the book jointly, brought together 50 plus authors, which explains the weight of the book. I apologize that it's so heavy. Hopefully you'll find, if not, hopefully more than one chapter that is inspiring for some of your work. As Camille noted, I'm a senior research associate in the Community Development Department. The book is actually a second in a series. Our office put out a book 2 years ago called Investing in What Works for America's Communities that examined the history and future of anti-poverty work. That book is still available at whatworksforamerica.org. And the third in the series is actually coming out on December 8th. That volume is about household financial stability, and it's called What It's Worth. The whole series has what. We joked about having it be, whatever, or, but chose to be a little bit more serious about it. It's about strengthening the financial future of families, communities, and the nation. And you can sign up for the webcast of the release event at www.strongfinancialfuture.org. Shameless promotion aside, I thought I'd start off by trying to answer what might be a burning question for at least some of you. What is the Federal Reserve doing here? If and when you think about the Fed, you might settle on monetary policy or interest rates or the safety and soundness of the banking institution you use. But in addition to teams of economists and bank examiners, the Fed supports a lesser-known function, which is community development. Originally a function that grew out of the passage of the Community Reinvestment Act in the late 1970s, my department's role has evolved to serve as a platform for lifting up best practices and improving economic outcomes for low and moderate income communities. Through research, convenings, and technical assistance, we support the work of the community development sector, which is a huge industry made up of public, private, and nonprofit partners that aims to improve the social, physical, and economic conditions in disadvantaged neighborhoods. This happens through activities such as developing and financing affordable housing, schools, grocery stores, community services such as childcare and health clinics, economic and workforce development projects, community empowerment, and other projects and programs that revitalize or stabilize low to moderate income areas. Increasingly, we work to build networks and align strategies across institutions, including banks, foundations, local governments, community-based organizations, and nonprofit intermediaries, as well as sectors, including health, housing, education, and transportation, all of whom are working on behalf of low-income people and places. This effort towards systems-level alignment and coordination is in recognition that poverty, and particularly intergenerational concentrated poverty, cannot be solved by one institution working in isolation on one piece of the puzzle. Rather, we need to work collectively to untangle the knots that constrain well-being and opportunity for disadvantaged populations and neighborhoods. We believe that the health sector is particularly important in this work. The links between socioeconomic factors and health are well documented. Factors such as employment, education, housing, and especially the community a person lives in all affect a person's health and well-being. For example, poorer neighborhoods generally have more crime and pollution than wealthier neighborhoods and often lack safe places to play and exercise, contributing to stress and hypertension. Residents of high-poverty neighborhoods are more likely to live in substandard housing that can expose children to multiple health hazards, including lead poisoning and asthma. In turn, a person's health can have significant effects on his or her ability to succeed in school, retain a job, and weather stressors that arise, all of which can limit economic mobility across generations. What's exciting is that there's a movement afoot for community developers and those concerned about individual and population health to work in a concerted fashion. The health sector, including both public health and medical care, is increasingly recognizing the importance of social determinants of health, the factors apart from medical care that strongly influence health and that can be shaped by neighborhood-level factors. And community development has increasingly turned its attention to the relationship between neighborhood improvements and residents' health outcomes. Both sectors are beginning to recognize that there are huge possibilities for amplification of positive outcomes if they work together. Now, working together toward community improvement is not easy. But one thing that we think can help is data. High-quality, timely data on community conditions can help level-set conversations among diverse stakeholders about the core conditions or assets that are present in a given place. It can enable a new degree of cross-sector communication. It can help to set shared priorities and goals and to galvanize community members as well as policy and decision makers around strategy selection and resource targeting. Data can help organizations get a handle on whether they are making progress toward agreed-upon goals, and if not, it can help prompt course correction. It can help illuminate gaps in service provision or overlaps, shedding light on why disparities might exist across populations or communities. Data can hold myriad organizations accountable to investing resources in what works, rather than what they've always done or that which is politically expedient. It can generate the evidence base needed to shift policy in ways that can support cross-sector alignment. All of this is to say that data holds a lot of promise for improving the work we do in communities, and especially in disadvantaged places. The challenge is that we are just at the forefront of the movement toward being data-driven, and there is a lot we need to learn in order to be effective. The book, What Counts, was an attempt to bring together current thinking on how to wield data to better understand the places in which we are working, and to support the design of interventions that are fundamentally more transformative than just building more housing units or more clinics. It's meant to serve as the background and basis for smarter conversations about data going forward, which is why I'm so excited about today's event. As I noted, the sheer weight of the book is a testament to the fact that there's no shortage of activity in the data space. The volume brings together essays from leaders in community development, health, law, education, and philanthropy to explore a couple of key questions. First, what are some useful ways of distilling the growing reams of available data into meaningful information that can guide decision-making and policy-making, particularly when working across sectors? Second, what are the key sticking points and barriers to improving the use of data across organizations and sectors, and how do we move toward resolving them? Encouragingly, our authors point to a number of tools and approaches that can help align the work of multiple stakeholders toward action. These approaches are most effective and useful when they align data on multiple topics, such that actors hailing from health, transportation, planning, and social services, or another domain, can see how their work relates to the whole. For example, in her chapter, Bridget Catlin discusses a process of building the county health rankings from numerous data points that aim to capture not just individual health factors, such as rates of tobacco use or obesity rates, but also social and environmental factors, like education and employment levels, as well as air quality and transit access. She discusses how the rankings can help a wide range of community stakeholders understand the many influences on health, and can help prompt inquiry into what actions can be taken to improve rankings over time. Aaron Wernham, in his chapter, talks about health impact assessments, or HIAs, which explore the potential health effects of a policy proposal or development in the built environment. HIAs can bring together qualitative and quantitative data on health risks and benefits, including proximity to public transit, healthcare, and healthy foods, as well as traffic and crime conditions. These data and the analysis that flow from it can help to encourage design changes or other infrastructure shifts that can reduce harm and maximize health-promoting outcomes. In the chapter by Milbury McLaughlin and Rebecca London, they discuss integrated data systems, which safely and securely bring together data on individuals from multiple youth-serving sectors, like schools, community-based organizations, and public health, which can help myriad agencies find opportunities to work collectively toward shared goals. By using a shared database to look across institutional silos, agencies can determine how to amplify one another's work and fill gaps. Pat Bowie and Moira Inkelis describe Magnolia Place and their data collection and reporting tools, which bring together ongoing survey data that tracks individual behaviors as well as community-level factors. By bringing together layered data, service providers can gauge the reach and success of programs that are being implemented by a variety of institutions throughout the target community, which spans 500 blocks in Los Angeles. These and many other authors thus emphasize that bringing together diverse information about individuals and communities can be useful for motivating action by community developers, city or county leaders, and health practitioners. But data doesn't come together all on its own, nor does it automatically hold weight in decision-making. In turning to the second question of how we might, on an industry-wide level, improve data use, many of our authors discuss how certain capacities are needed to transform data into information that can be easily absorbed and used by key stakeholders. They also emphasize that there are key shifts in organizational culture and leadership that need to ripple across sectors and institutions to enable not just data use, but also the openness, humility, and spirit of learning that can boost the significance and meaning of data. First, capacities. Over analytical skills, our authors discuss the importance of communication skills, skills to put data into a visual or narrative format to help non-data people make sense of it. Several authors discussed how data visualization approaches can help make complex ideas more easily understood by a range of audiences. Pat Bowie and Moira Inkelis describe how the Magnolia Place data dashboard serves as a visualization of the community network's theory of change and helps community partners engage in shared learning about systems change across the entire community. Bridget Catlin describes the ways that graphics and data visualization tools used for the county health rankings have evolved over time to help lay people understand the multiple factors that contribute to health outcomes and to help users with different levels of skill access the data in formats that are meaningful to them. Raphael Bostic, in his chapter, also focuses on this issue, discussing the critical importance of storytelling and getting policymakers in particular to understand data and how it relates to the communities they serve and the budgets they manage. Other authors emphasize that critical thinking and judgment skills are of utmost importance as we move toward more intensive use of data. This is to say that our authors are not so naive as to consider data as a completely neutral source of truths. Rather, they speak to the limitations and pitfalls of data and caution us that we must be cognizant of the values, assumptions, and power dynamics embedded in the construction of data systems and in the use of data for decision-making. A number of authors discuss, for instance, how there is considerable subjectivity embedded in what seem from the outside like objective data platforms and systems. A range of choices are made in developing data tools that synthesize and distill data into more manageable and actionable information. These range from decisions on which data to include in the first place, which geographic scale or comparison point to examine, and what the thresholds are that differentiate success from failure. Perhaps most importantly, our authors implore us to be attuned to the potential of data systems to overlook, undercount, or misrepresent certain populations or practices, especially those that are difficult to count or measure. Meredith Minkler, in particular, focuses her chapter on community-based participatory research and emphasizes that community residents must be involved in data collection and analysis processes in order to help ensure that data reflects conditions and concerns on the ground. Above and beyond skills and capacities, though, our authors discuss how organizational culture and leadership approach can significantly impact the quality and sustainability of data collection and use, and can affect how deeply a data orientation can be infused within and across organizations. Culture and leadership relate to the priority that is placed on data collection, analysis, use, and sharing, which in turn affect how time, money, and attention are allocated to these processes. As such, our authors remind us that implementing data-driven processes require that myriad players, from frontline service providers to grant writers to board members to funders, need to understand the value of data and have the support and training to use it well. Otherwise, data collection can be perceived as extraneous to the real work, a burden rather than a tool that can help improve processes and functionings of organizations. For example, Susanna Vasquez in her chapter discusses how integrating multiple forms of data use into everyday practice, whether for monitoring and adjusting program execution, generating accountability among partners, or measuring impact, required significant investment of staff time and financial resources, and as such meant that staff, management, and funders needed to shift their priorities to support the work. Our authors also discuss the need to cultivate organizational willingness to step away from well-worn paths and adopt new practices, especially when attempting to develop multi-organization strategies. In their essay, Fred Karnas and Bill Kelly discuss how these issues played out in developing the Outcomes Initiative. This project aims to align 15 of the largest national affordable housing developers toward collecting common data on a range of resident outcomes, from health to education to financial stability. The aim of the project is to develop a data set that is useful for building the evidence base on the relationship between service-enriched affordable housing and social outcomes. In implementing the collection of a set of shared metrics for the data set, developers had to be willing to commit to new roles and tasks that were defined collectively, not through sole control, which was uncomfortable yet necessary. Perhaps most important of all is that we need to make sure that we move ourselves to a mindset that data is for learning and adaptation, and not just for reporting or compliance practices. Throughout the essays, our authors emphasize that data is a potent tool for enabling reflection, growth, and change. In essence, the data is useful not just for tracking what is, but for prompting questions of why those conditions exist, and for helping to consider what else could be the case, and how we might shift our professional practices or organizational behaviors to achieve better outcomes. Ultimately, then, the message that comes across for me in What Counts is, while there are a lot of promising data practices already in use, we need to set ourselves upon the task of collectively building better data infrastructure, which includes technologies, but more importantly, capacities for data collection and use, as well as supportive organizational behavior and professional cultures. Data infrastructure, of course, is not very sexy. As such, we need to emphasize the higher purpose of this work. What Counts explored the landscape of data as a means to stimulate a conversation about how data can be about more than just accountability, tracking, and evaluation. Rather, data has the potential to help illuminate the possibilities of coordinating collective action toward better quality of life for all Americans. The stakes to do just this are incredibly high. Income inequality is increasing in many of America's communities, and due to both domestic and global economic factors, many rungs on the ladder of economic opportunity have grown further apart or have been knocked out altogether. The geography of poverty is shifting, such that it is no longer just a central city or rural issue, but is straining suburban areas once considered to be the locus of the American dream. Cities and regions unable to equip all their residents with the abilities and skills to participate in the economy are struggling to balance budgets and keep the lights on. At the same time, healthcare costs have spiraled out of control, and health disparities across populations and places are stark. We must figure out how to upend these conditions. Our task is thus to make sure that we are pushing ourselves to build the data infrastructure that enables us to collectively learn our way forward toward policies and programs that reduce disparities in health and wealth outcomes. We need to build the capacities and cultures that enable us to use data to find avenues for moving our society toward more broadly shared opportunity and wellness. The thought I want to leave you with, then, is that data is about more than just data. That exclamation point on the top of your agenda is important. It signifies that data can be a powerful tool in generating a comprehensive vision and narrative about what our shared and collective goals can and should be. I look forward to the rest of today's conversations and hope that they inspire us to lift our collective capacity to produce improved outcomes for the communities we serve.
Are there any questions to start out for Ms. Cytron? One question that I wanted to sort of pop at you. There are a lot of, in the book you talk, some of the authors talk about integrated data systems and getting nuanced data, it's different from just, one thing, straight line data. And also having community involved in evaluating this nuanced data for what ground truthing or something like that, where you know whether or not it's meaningful or suggest other things. But also people tend to be very distrustful of data, and especially of sophisticated. So I'd just like your thoughts on how we can increase community capacity and hunger for these types of data, and also help them own the data generation process so that they can say, well, nobody's trying to pull the wool over my eyes with these statistics.
No, that's a really important question. I think that there's a long history of using data against people, right? And that there's a reason why people are distrustful of data that is not generated internally within communities. I think that there, especially in Meredith Minkler's chapter where she talks about community-based participatory research, she explains a range of efforts to engage community members in generating the research questions that are relevant to them, to make sure, and making sure that there is cultural competency among researchers and community health workers to make sure they're asking the right questions and asking them in such a way that they are understandable by community members and that community members are engaged in making meaning from that data. She talks about different ways of including community residents in collection of data, from strapping on asthma, recorders, air pollution recorders, and because those issues were voiced by community residents as issues that were relevant to them, rather than just external folks coming with spreadsheets and graphs saying, we're concerned about these issues. It was generated by the community themselves. But I think that trust is not gained easily, and that there is a piece of the work that has to be about community empowerment and engagement and organizing through networks that include churches or schools or other places where community residents know one another and can come together collectively, along with researchers who come with a spirit of humility to engage those community members in what's most important to them.
Any questions? Jennifer, do you have a question? Okay.
Nope. Can you hear me? All right. So in the book, you talk a little bit about evaluating work on the social determinants of health, and I know we have a lot of folks in the audience who are really interested in changing our region's social determinants of health. So could you talk a little bit about what you learned in that chapter of the book?
Well, to me, community development in my mind is all about social determinants of health. Sometimes my colleague David Erickson, he talks about how this is based in Robert Wood Johnson's work, that your zip code is more important than your genetic code in influencing one's health outcomes, and that community development is in the process, the business of zip code improvement. There's a whole arena of community development players that are working toward housing, housing improvements, economic improvements for low-income populations, all of which that is what shapes the social determinants of health. One's income, one's neighborhood, access to jobs, access to good schools. So thinking about bringing together data from all of those players, and there are a range of entities, whether it's your housing department, whether it's a university partner, that are collecting information about community level factors. Those those pieces that play out at the neighborhood level are what you need to be looking at and thinking about the social determinants of health. What are the population level factors that ultimately ripple down to how an individual person can access opportunity, whether that's education, whether that's a job, whether that's a stable and safe housing unit. Those are some of the components that need to be measured on an ongoing basis at the community level to ensure that opportunity is broadly shared, and if not, if there are places that are that display particular disparities in income, in transit access, that is a signifier to bring together partners into your health work that can address some of those pieces. So I don't know if that totally answers the question. It's actually a huge question. But thinking of, what's tricky is that a lot of data is, it's available at the county level. So the county health rankings, which does a really great job of drawing together both individual level health behavior, data on individual health level behaviors, as well as community factors. It's only available at the county level. And we know that disparities are happen on a much finer grain at the neighborhood level. So figuring out how to use available census data to map out where disparities exist, and not be scared about, so census data has its flaws in that now that we've transitioned to the American Community Survey, sample sizes are much smaller and there's much higher margins of error. That said, it's the best we've got right now, unless your community happens to be doing really intensive data collection through survey work or other mechanisms. Or there's administrative data from your city department that helps to capture information at the block level or zip code level, anything that's slightly smaller than a census, the county level information can help illuminate what are some of the disparate conditions that exist for certain populations, whether that's by race or geography, to help identify what some of the target areas might be for the communities that you're serving.
I'm wondering if you could talk about, for your previous work before you got to the Federal Reserve Bank, what are the top 3 things that you learned that are helping you now?
Oh, wow. That is a big question. So in my early days, I thought that I was going to be a public health practitioner. In college, I studied biology and thought that I was going to go and do public health work. Worked at a women's health clinic for a short amount of time before going to graduate school for city and regional planning. In planning school, thought that I was going to do housing development. But all of the work that I'd done in biology helped to inform sort of an ecosystem approach toward doing all of this kind of work, and that we always need to be thinking about feedback systems and iterative loops in doing the kind of work that we're doing, and that everything is interconnected. So to build a housing development, which I thought I was going to do, is not enough to help improve community level conditions. That housing is a platform, but only if it is located in a neighborhood where there's also transit access and high quality schools and grocery stores and a range of other amenities and factors that help someone to do all the things that all of us do with our daily lives. So thinking about the interconnections among all of the sectors that are working to improve opportunities for low-income households, we all need to work collectively. It's much harder than just saying it, though. We have a ton of regulatory structures and policies and financing tools that make it difficult to align work across sectors. So part of our work has to be not just drilling down into the individual arenas that we work in, but kind of looking up to see what are the regulatory structures, what are the policy pieces that limit our abilities to partner with other organizations, or to think about what the implications are of our work on a person's ability to access access jobs or have the training to access that job. So really thinking about this ecosystem approach, and also the fair housing work was interesting in that it really shaped my understanding of how discriminatory practices still shape the landscape for so many Americans. So that work was in 2000, and I was working in Montgomery County, Maryland, and looking at discrimination in the rental market, and it was shocking to me. It shouldn't have been, but it was shocking to me that there were very clear patterns of discrimination that were still happening in rental markets, limiting the ability of families with children, of African American families, of families whose source of income was Section 8 rental vouchers, to access housing units in neighborhoods that might have afforded them better conditions, safer conditions for them and their children.
How do you view this, though? I mean, the micro system, what we can change there, but this macro view, because, I mean, do you see, I'm thinking of the whole tendency now in the federal system to move back, the push back towards changing welfare as we know it, block grants instead of specific programs. Are we, while you're seeing this new horizon of intersectoral, interdisciplinary realization of the ecosystem approach need, at the same time, it seems like we've got this other movement, which is just kind of moving, back to individual responsibility, or, that the poor got themselves into this and they're going to have to get themselves out kind of thing. So how do you see these forces kind of?
Yeah, it's extraordinarily complicated, right? It's a very interesting time, in that federal programs, as you note, throughout the Obama administration, there's been a real push toward aligning, especially federal resources, toward cross-sector work. The programs like the Sustainable Communities Initiative, Choice Neighborhoods, Promise Neighborhoods, all of which are trying to braid together federal funding sources to do this work differently on the ground. And yet, there are sort of entrenched political interests to keep that from happening. And I don't have a good answer for how to combat that, except that innovation on the local level is really, really important. And just making sure that institutions are working proactively to consider how to partner and use the resources that are available to do the integrated work, in spite of the fact that there are pretty strong voices at the federal level, and that we haven't reformed certain pieces of legislation that might help us do this work a little bit better and support especially low-income households. So I wish I had the silver bullet, but I don't. But I think it's a great question.
Okay, we have time for one more question. Please go ahead.
It's on? Okay. Thank you. How might we use specific types of data to elucidate and encourage that connection between community health and jobs via the relocation sometimes of new business? If we want them to move into the community, we have to have a healthy community with low absenteeism and so on. So how might we encourage the correct types of data collection that would help to show that?
I think it's an important point. So not just collecting data on the gaps that exist in community, but also the assets that are in a community, right? So thinking about collective buying power in a community, thinking about what are the various skills that workers can contribute to potential jobs that are of varying skill level across the spectrum. What's difficult is that employers, especially large employers, I think you're talking about sort of the economic development side of things. It's tricky because the incentives are often not aligned with the goals of improving access for jobs for low-income people, thinking about greenfield development on outlying suburban areas. So a piece of that is thinking about transportation. A piece of that is thinking about what are the school systems like and how to improve educational and workforce training programs. Thinking about how all of these things feed into one another to support communities' ability to access and retain jobs, and for that employer to know that there's a ready and willing pool of workers that are supported by community-serving infrastructure, I think is a key piece of it. So it's this piece of aligning multiple types and forms of data, not just using one data point about the poverty rates in a community or the education levels in a community, but thinking about what are some of the assets that you can point to that demonstrate the vibrancy of a place in spite of some of the gaps that might exist there.
One last
question. So we have
go ahead.
We have an issue with violence and gun violence in particular in our community. Have you seen communities that have used data to help have an impact, positive impact on the reduction of gun violence? Are there any examples of that you know of?
Do you want to go ahead?
The question was about using data for understanding how to reduce gun violence and violence in communities. It's not a piece that I know very well. I know in Baltimore there was a real effort by their police department and city government officials to use sort of performance stat type metrics to understand how to guide and target community policing efforts in certain neighborhoods, but I think that's probably not enough. Thinking about how to institute other kinds of community safety, community organizing types of efforts, so that there's ways to promote safety both internally and externally. But it's not. I wish I knew an answer to that question, because I think it's a problem that plagues communities across the nation, and it's something that we should focus more of our attention to.
Okay, one more question, the gentleman here, and then we'll have to cut it off.
Yeah.
Sir?
I am truly interested in the impact and your impression, please, since you represent an institution where money is. What are you doing to really get us out of our silo mentality so that we can really work in a shared partnership for sharing data? And at the same time, and in the same breath, what would you recommend as it relates to funding that can help us do this with education amongst ourselves?
No, that's a great question. I mean, I think part of, how can we as an institution help to foster alignment across organizations and encourage the funding that can make it happen? Part of the rationale for this book, for What Counts, was to highlight the various players that need to be involved in this work, and hopefully encourage those from different who are currently working in silos. They need to be thinking about what's happening in other sectors. The funding question is important, especially for foundations that often ask for measurement of outcomes, but then don't fund the data infrastructure within even an organization, let alone infrastructure across a community that might help with data sharing protocols, transparency that needs to be fostered, the trust that needs to be fostered in order to get to that data sharing work. So there's pieces of needing the foundation community to understand that there's a need for explicit funding for data infrastructure. Banks and other, the Federal Reserve Bank is an interesting institution in that we have money, but only insofar as that we take it in from banks and make sure that it's not counterfeit, and then we send it back out. If you ever visit a Federal Reserve Bank, you'll see that there's a lot of security at those banks because they've got billions of dollars in the basement. But the bank does not make loans or investments in communities. Our real role is to bring together convenings like this, produce educational materials, provide technical assistance for a range of public, private, and nonprofit institutions to help do this work better and make sure that the right questions are being asked, and figure out how to promote innovation and new thinking, and even to lift up the old thinking that may not have already had its due. So that's the best I can do. Yeah.
Thank you very much.
Thank you very much.
Thank you so much. Good morning. My name is Rochelle Seeger. I'm with the Foundation for a Healthy Kentucky. This is thrilling this morning, a great opening presentation, and the questions just kept getting bigger and bigger and bigger. So we're all warmed up. Please, if you're asking a question from the audience, please kindly use the mics. They're here for you and our speakers. Welcome to the Data Forum 2015. We're thrilled you're here. We're on a break. So please, make a button. You see I have my bling on. Make a button. Visit the health landscape table just outside the door. Please join us back here in this room promptly at 11 while we continue our morning session. Thank you.